So I know that today we're going to be talking about many things, but before we start talking about cancer, I'd like to ask you some questions about you because despite the fact that we've been colleagues and friends for a long time, and that have you have had me on your program, and I like to get together as well with you, and we've been collaborating. I do not know as much about you as I would like to know. So I can tell our listeners, most likely our listeners and viewers know you anyway. But for those of you who do not know you, I believe that you graduated in the 80s, similar to me, and you have been practicing veterinary medicine and holistic medicine for some time. And you have come to a realization that conventional medicine is not the fix for everything, and you've been practicing. You're laughing. And you've been practicing Chinese medicine and nutritional therapy and chiropractics beside the veterinary kind of part of your profession or your job. Um, I consider that part of the job, but some people would divide it into chiropractics and Chinese medicine and nutritional therapy and veterinary medicine, and I think it's all together.
I
So
agree.
tell me, I really love to know and learn how your childhood was different from other people, or what do you think was different, and how do you grow up? Because I know that quite often uh, we are, well, often, pretty much all the time, we're affected and influenced by our childhood and by our life. And so, how did you grow up? Where did you grow up? And
I grew up in a small town in southern New Jersey. My father was a salesman, and my mother was well, she stayed home until I was in second grade, and then she became a school teacher and she taught grade school. My mother grew up on a farm, and so she had a great love for animals. My father, his family had hunting dogs, so they used their dogs for a purpose. And
Mhm.
they usually only had one dog at a time. And my father's not an animal person by any stretch. My sister and I wanted a cat for so long, and my dad is anti-cat, and so there were no cats in our household. I got my first one my first day home from my honeymoon after after I got married after that school. So I was like, I'm on my own. I can get a cat. And the life changer for me, that I had the love of animals from my mother, and I think that my love of teaching comes from my mother, because now that I've really retired from physical practice, my platform
Mhm.
is now an educational platform. And I really do enjoy teaching, and I enjoyed teaching the clients when I was in practice. But the game changer for me was my sister always wanted a horse. And I just sort of kind of went along with whatever. She was older. And she got a horse when we moved from New Jersey to Virginia in junior high. And my sister was just absolutely mad. And my dad said, "Look, if you'll just get off my back when we move to Virginia, I'll get you a horse." And she went, "Okay." so, so we moved to Virginia, and we, went to a horse dealer, bought this old, broken down, probably 35-year-old pony that, we didn't know anything. And within a few weeks, here's my mom and my sister and I were going out to where we're boarding this horse and taking care of it every day. And we were all trying to ride it. And we said, "I think we need another horse." So we went back to the same guy. We bought a 3-year-old pony that knew nothing, and we knew nothing. So really bad mix, but it worked out. And then we moved back to New Jersey a year later and brought the horses with us. And my mother enrolled us in 4-H. And 4-H was the game changer for me. I had to learn public speaking for 4-H. I had to learn something actually about the animal I was caring for and didn't know anything about. We started
Nice.
showing our horses. We had a devastating loss. All the horses on the farm where we were keeping ours developed equine infectious anemia. It was
Oh
the largest
no!
outbreak.
Oh
Yeah,
no!
largest outbreak in the state of New Jersey. And it was when
Oh.
I was entering high school. And so the last thing you want is to tell a preteen or early teenage girl that the love of her life is about to go to the slaughterhouse.
Mhm.
So
Mhm.
it was pretty devastating for us. But then my parents bought us new ponies for Christmas as a surprise, which was great. Bought us better ponies. And my pony was old and kind of decrepit, but they knew that I needed somebody to teach me. So they got me one who had a lot of miles on him. Basically, they should have kicked the tires first, but they didn't. But um, and I was able to show him and learn a lot for a couple of years, and then he became so lame that I couldn't ride him, and we wanted to turn him out in the field, but he was so lame that he couldn't even like trot across the field to be with the other horses. So my trainer's daughter was a equine veterinarian from Canada, and she came home for the summer. And she said, I can do a neurectomy on your pony. And I was 13. I can do a neurectomy on your pony's front feet, where basically we're going to remove the nerves so that they're kind of numb, and you're not going to ride him anyway. He can be out in the field and be happy. And she let me assist with the surgery in the field at the barn and taught me how to do the aftercare. And that was it. Game on. This is what I'm going to do. I'm going to be a veterinarian. Nobody's going to talk me out of it. So that's...
This is so interesting because I'm not sure whether you knew, but the first pet that has influenced my life was, it was our dachshund. That was, she wasn't our pet. Like, she was basically our boss and our sibling. But then because my dad thought that our dachshund was our sibling, our sister, his favorite daughter, actually. Anyway, but then I started riding, and I had a very similar experience with a horse that had chronic tendonitis. And I went through the treatments because my dad was a veterinarian, and I went through the treatments with her, but I didn't really like the treatment because it was blistering and all sorts of different treatments that I didn't really like. And I felt really helpless. And she brought me to realize that I wanted to learn how to help not only her, but other animals, because, it was such a close to heart experience. So, it's what month are you born? What sign are you?
I'm a Cancer.
You're Cancer. Yeah. June. Yeah. I'm in January. I'm an Aquarius, but it doesn't matter. It's really interesting how parallel our lives are. So, was there any crucial point in your career where you realized that actually conventional medicine is not the end all and be all? You always
Well,
laugh. You always laugh.
because listen, my life is a series of stumbling forward and falling into things accidentally. There's been no plan.
Do you really believe that happens? There's always
it's fate.
reason.
I mean, the path is laid out, and I just happen to be falling into the path that was laid out. I can't predict it, and I wouldn't. If you had asked me when I graduated vet school, are you going to be a holistic veterinarian? Are you going to be a public figure? I would have said no. But interestingly, and this came up not too long ago, when I was about 6 or 7 years old, I used to have dreams of people around the world seeing what was going on in my daily life, like a TV show of my life that people around the world could see. Well, here I am living the TV show of my life that people around the world see. So again, the path is laid out, but I just keep falling into it somehow. Luckily, I have a good leader. But so the holistic thing, when I was actually really disenchanted with veterinary medicine I kind of liked the first year, but I worked in a really, really low quality practice. And then I moved to a better quality practice, but my boss was just not a good guy. And I got really disenchanted with veterinary medicine, and I got really disenchanted with talking about heartworms and fleas and chemicals and prescription diets. And I actually hated the profession. And I was invited to speak at a college for pre-vet students. And I was so miserable during the talk. At the end, they were like, why would anyone want to do that job? And if you hate that job so much, why are you there? And I was actually trying to be upbeat. So that's how bad I was. And I just literally said, I can't talk about fleas and ticks and heartworms and drugs and prescription diets one more day of my life without ripping all my hair out. I don't want to do this. I'm bored. I'm not making a difference. I wasn't happy with it. And so I left that practice actually I got fired for being pregnant, but that's another whole ball game. But it was
after all, it was the 80s, right?
It was the 80s. I got fired for being pregnant. And so I started doing relief work all over New Jersey and Pennsylvania. And I actually enjoyed being my own boss and doing the relief work. And one of the people that I did a lot of relief work for asked me to join his practice. And I said, I will only join if I can be a part owner because I'm not working for somebody else anymore. And he did a lot of orthopedic surgery, and I did not. I did a lot of surgery, just not orthopedics. And this thing came across my desk, an ad for a course to help our animals heal faster from surgeries and help them heal from injuries, blah, blah, blah. And the course was called Veterinary Orthopedic Manipulation. Well, I'm thinking, okay, he does the orthopedic surgery. This must be some sort of rehab thing. This will give me a foot in the door. Like, I'll be able to help with these cases too. So I'll be an asset to the practice if I do this. So I took the course. I had no idea what I was taking. I get to the course. Within a couple of hours, I'm like, this guy's talking about chiropractic care. I don't even believe in this. I don't even know what I'm doing. What am I doing? And, I paid for it. I was there, stuck it out. By the end of the course, I was like, maybe there's something to this. I don't know. But I came back to work, and the first case in the door on Monday morning, I used my brand new chiropractic skills, and I had a 95-pound dog that was carried in, and I did my little thing with his back, and the dog literally got up and ran down the hall, and I went, and I was hooked. I mean, and that was it. So then I had to go through the whole crying and grief process of, oh my gosh, if I had known this little trick over the past 10 years, all those basset hounds and dachshunds and animals that couldn't walk and had back problems and, they weren't getting cared for the way they needed to. Like, I've killed so many animals and put them down when there was something this simple that could have saved their life. So you have to go through that whole process. But it opened a door for me that I didn't really even know existed. So then I jumped into homeopathy, and I jumped into raindrop therapy and essential oils and color therapy and light therapy. Like, you name it. I was just like all over the place trying to figure out what else was out there. And when I discovered TCVM, I was like, oh, here we go. This is what I like.
So you just basically, it just, there is no coincidence. It just happens. And then you just go with the flow.
The door opens and I just stumble through and go, okay.
So if you were a traveler, you would be an adventure traveler, right? Like, you just kind of venture out. Yeah, absolutely. I can see that. So what surprised you?
I'm not good at planning ahead. So when I go on vacation, I have to go with somebody else who makes the plans. Otherwise, it's like, what are we doing today? I don't know. Let's figure something out.
I have a feeling that life just plans for you. I think that's probably the best description of your life. So what surprised you the most about medical science? So I know that you made these discoveries, but what surprised you the most about just veterinary medicine in general?
What surprises me now?
What surprised you throughout the career or now, or, it's an open question.
Well, things that I've discovered over the years that I'm not happy about that did surprise me is how much influence the drug companies and the food companies have on our careers. And, now they're doing things like taking over our imaging and our laboratories and our clinics. And it's, when my eyes were open to all of that, it's aggravating, it's angering. And I think that's part of why I work so hard at trying to educate both pet parents and veterinarians, that, there's more out there than what, we're given this little tiny sliver to look at, and, with very focused vision, based on, and I should have known that. Our senior year of vet school, this drug company doesn't exist anymore. It's been absorbed multiple times over, but it was called Upjohn in Michigan. And when I went to school in Illinois.
I remember Upjohn. Yeah.
Yeah. So they had all the little red and white boxes. And so senior year, Upjohn wines and dines all the Midwest vet schools. And so they bring all the senior students up, and they, put on the party of a lifetime, tour you through the facility, explain all of their drugs. And, part of it is, we are being very nice to you and in return, we expect that when you have to pick a drug off the shelf, you will choose one of our drugs. And I have to tell you, it worked, because my, first year in practice, I was like, oh, there's that red and white box. I know that. So it works. The second clinic with the boss that wasn't very nice, we sold more prescription Hills Science Diet food than any clinic in the country. Like there's a chapter in my book that's called Dog Food Salesman, because that's what we were. He got trips all over the world for pushing that food.
So, we kind of know that the situations, most dog lovers know now, and there are ways of, I always recommend to be in practices or find a veterinarian that is independent or not part of the big corporations, because we support independent businesses. It's the same thing in anywhere, right? Like independent stores, independent bookstores, independent whatever it is. I think that maintains the fabric of our society and the business, and makes it healthy. Because otherwise, if the bigger fish swallows the small fish and it goes forever, then we have just one big fish, and that's a big problem, full of toxic mercury. In quotes, that's the synonym for that. Anyway, we're going to get to cancer soon, but I just have a few more questions. We started about veterinary medicine and veterinarians. Are there any misperceptions that most people have about veterinarians, actually, that you would like to address before we dive into the topic of cancer and go that avenue?
One of the things that I see on social media quite often is that veterinarians are only in it for the money. That, they're recommending all this testing because they want my money. I can tell you that very few veterinarians went into it for the money. If money was the only concern, they'd be in a different profession. It doesn't pay very well. And
it's misperceived, isn't it? Because the bills are high.
The bills are high, and they're getting higher. So is everything else.
But the expenses are very high as well, and nobody runs a human hospital on their own. It's usually government run or state run or somehow subsidized, and veterinarians are forced to run full facilities with x-rays, with equipment, ultrasound and lab machines and all that, and staff, and they have to manage not only the healthcare, but also the team care and managing all that. It's very stressful. Yeah.
And I think it's even more stressful from the fact that veterinarians really aren't given any good business courses. We're scientists. We're compassionate animal lovers and scientists, and we're not good on the business side, the majority. So it's a lot to juggle, as particularly as a practice owner. I almost blew it a few times not being able to manage the practice. And when we had the last recession in 2008 and 2009, I would say about a third of the practices in a 50-mile radius of me closed down. And it's very, very stressful. Yeah. So I would like people to know that, no, your veterinarian is not just a money-grubbing machine. When they're recommending testing, they're recommending it because they have a suspicion or they're trying to get to the bottom of something. And it is called the practice of medicine. It is not black and white. Trying to figure out what is going on sometimes can be a very circuitous path. And, if you really want to get answers, you're going to have to open the book and try to, figure out what's going on with your animals. So, I would caution people. Certainly, if you have a limit on your budget, make sure that they know that, and make sure that you're doing things in a sequence that makes the most sense. Don't just jump in head first and go, $10,000 in diagnostics. Let's narrow it down. Let's figure things out. So, and I think that I also would like people to know that veterinarians are under an inordinate amount of stress, and right now there is such a veterinary shortage. One of my technicians, who had been in my practice for 18 years, just quit because clients have been so rude and horrible. She couldn't take it anymore, and she left. And that's very sad.
Yeah, it's it's really complicated. We have also not been given any education in how to handle the level of stress and how to actually deal with trauma, not only on the client side and dog side, but also our side, right? So it becomes very complicated. I've been very passionate about actually learning how trauma works in the body and how the neural pathways are created and how it affects every day of our life. It's very interesting, and but that's another topic. So before we start talking about cancer, what do you think is the easiest condition or problem to treat in veterinary medicine in dogs? Let's say, because we are dog centric, our my side. So um,
I always loved like senior dog issues, like arthritis, mobility problems.
mhm,
I have so many tools in my toolbox for that it's like I can fix
mhm,
that.
mhm,
Allergies are one of the most frustrating things in
mhm,
my existence. It makes me crazy, particularly when we get these animals that have been on all kinds of immune suppressant drugs year after year after
mhm,
year. They've been
mhm,
on multiple courses of antibiotics year after year. Uh, Poor diet. It's like everything that you can do wrong has been done wrong
mhm,
for years. And then it's like, well, you're the holistic doc. You need to fix this. And why isn't it fixed
mhm,
next week?
mhm,
And so those are really frustrating to me. Inflammatory bowel disease is also really frustrating to me. They go
mhm,
about 50-50. Like half
mhm.
of them, I do a diet change. I figure out where I want them to be and I do a diet change. And the next day they're better. And it's like, yeah, I love you. And then the other half, it's like, really, we're going to drag this out. It's going to take us a year to figure you out.
Yeah, people have the impression that well, fewer and fewer people, but there are still people who come to you and say, "Hey, Dr. Judy, fix it."
Yeah.
Especially the guys. I don't want to divide guys, ladies, but it's like usually the guys say, "Hey, I have a dog. There's a problem. Fix it." I actually one time I give this story a lot, but hopefully people didn't hear it on this program. I when I worked in Whistler, which is a small town in British Columbia, and it's a ski town, and there were a lot of Germans living there, and I had one German client, and she would usually come and she said, "My dog is sick. This is what it is. This is what you're gonna do, yeah." so so it was very funny. So that's how
Sure.
that's how we fixed our dogs. And I knew that I can't really like I have to find like if she wasn't exactly on point, which happened quite often, I had to find a way of making her feel that she really made those decisions, right? Because otherwise, and that we really went with her plan. Otherwise, I would be in trouble. But then there were other people, obviously, who came and just virtually said, "My dog is sick, fix it," right? And that should be easy. If it was easy, everybody would be doing it. So it's
Exactly.
always
That's why they
so.
call it practice. We're still practicing.
We're still practicing. Practicing. I think that everyone is practicing life. That's the thing, right? And
There you go.
and so we're all in the same boat. Cancer. I know that we've planned to talk about cancer, and I I'm somewhere in between. Like I like the conversation on cancer because they clarify what can be done or can be done. I also find it really bizarre that people sometimes see cancer as another form of departure from, let's say, liver disease or cardiac disease or diabetes or terminal stage of life due to age. And I find that cancer, at least in my mind, is just another way of the body kind of not being able to cope with daily functions and so on. But it is so difficult because it can be so devastating. It can be so right there. And so the first question that I have for you is, what do you think? Can cancer be fought? What do you think, like in advertisement or in fundraisers, people often say, we're going to fight cancer. Like, do you think that it can be fought?
You know, I I think if we could look at it a little differently, And it's interesting because I just taped an hour-long presentation on cancer about 20 minutes ago.
We're prepared now. Now
Yeah,
you practiced, right?
yeah, it was my practice. Well, and we did Cancer Week on our Facebook Live a couple weeks ago, and so I had a full week of having to focus in on it. And I think that sometimes we look at cancer from the wrong lens. And I would tell people when they came in with their pets with cancer, it's not a battle, and we're not fighting. Um, we're trying to empower the body, really. And so when they come in with cancer, it kind of depends what the cancer is, but I usually have a conversation with the client and say, look, you need to talk to the cancer, and you need to say to that cancer, look, I don't have to kill you as long as you don't kill my dog.
Mm-hmm.
So
Mm-hmm.
my goal is not annihilation. It's not nuclear war, because we might kill the dog in our nuclear war.
Mm-hmm. Mm-hmm.
My goal is to strengthen that dog, strengthen that animal so that their body can do the work that needs to be done. And yes, we might use some herbs or some nutraceuticals or things that might sort of target, cancer cells, bind up some of the iron that's inside the cells so that we're starving them a little bit. We might change the diet so that we're starving them of their sugar reserves. We might give some herbs that don't allow neovascularization or new blood vessel growth into the tumor. But I literally tell it, look, I don't have to kill you. That's not my goal. I don't have to kill you. I need to keep the pet alive, and I need to keep the pet comfortable. And so I think I would like to look at things from a positive aspect rather than just so much negativity.
Mm-hmm.
We got to kill everything.
Mm-hmm.
We got to kill everything. And, no matter
Mm-hmm.
what it takes,
Mm-hmm.
it's a negative way of looking at things. And I think if we can turn that around, because decreasing stress and being able to and go through daily, looking for good days instead of bad days.
Mm-hmm.
I think it's
So
important.
you're basically strengthening the body, making sure that the body is stronger to negotiate with the cancer
Yeah,
and navigate
exactly.
through the cancer.
Right.
We know from real life that force very rarely leads to any positive results. So I really like your I really like your attitude towards cancer. So what should people do first when their pet got a diagnosis of cancer? And let's say that it's a malignant cancer that is relatively serious. What is the first thing that people should do when they get a diagnosis?
Well, it kind of depends what their starting point is. So if their starting point is that it's a pet that has, is eating dry kibble, is eating food that is not high quality, that would be the first thing I would focus on, because nutrition
Mm-hmm.
is, in my mind, but maybe just because I happen to be a food person and that's what I do, but in my mind, food is the foundation of life. And if we don't get that right, nothing else is going to be right on top of that. So I don't care how many drugs or herbs or therapies you throw at the animal with cancer. If you don't get their nutrition fixed, if you don't get good, solid, human grade, preferably organic nutrition into them, you're
Mm-hmm.
never going to have a good outcome. You're going to, well, I shouldn't say never say never. You're going to really struggle to have a good outcome because
Food
you're
is the
feeding.
greatest medicine.
Yeah.
And I agree with you, because there are no human doctors who would say, oh, you got cancer, just continue eating the junk food and it's going to be all fine, right? So it's there are no human doctors who say that, but it still happens in veterinary medicine. So I know that many people jump, or not jump, but they are forced by life to deal with cancer and look for treatments and methods and so on. But we know that prevention of cancer is very important, and maybe more important. So if you could create an ideal utopia or world where the right things were done, and there would be focus not only on treatment but also prevention, what do you think the ratio would be in your utopia world, or in the ideal world? Prevention versus treatment, meaning in research, in focus of veterinary medicine, and even in the effect, because we know that treatment is often difficult and prevention is not as difficult, but it is more likely that people only start dealing with the problem reactively. So in the utopia, how much focus should people and energy should people should give to prevention versus, let's say, the potential treatment?
Majority should be on prevention because you don't need treatment if you can prevent. Now there's there is a small subset of breed predisposition to cancers. Look at the Bernese Mountain Dogs; they're kind of a train wreck right
Mm-hmm.
now,
Mm-hmm.
as far as their cancer. And I have had really good Bernese owners who have done everything holistically. Skipping the
Mm-hmm.
vaccines, feeding the raw
Mm-hmm.
diet, doing everything they're supposed to be doing, and they're still losing their dogs at 5 to 7 years of age, and it's
Mm-hmm.
very sad. So we definitely have that small genetic component, but that's a very, very small part of it. I think, like, literally, I've had this discussion multiple times in the past couple of weeks, and I don't know why. But somebody asked me, where does good health start? And I said, it starts on day one. And I went, wait a minute. No, it doesn't. It starts way before there's even a twinkle in
Mm-hmm.
mama's eye, because
Mm-hmm.
mama has to be healthy. Mama has to have a healthy immune system. And if mama doesn't pass on that healthy immune system, then the puppy or kitten is kind of screwed, even at day
Mm-hmm.
one. So it really
Mm-hmm.
starts back generations, really.
Mm-hmm.
And if we want to really focus on prevention, then we need to focus on looking multi generations out,
Mm-hmm.
and starting out with parents that have a good healthy immune system that are going to pass on a good healthy immune system. Parents who are fed a good diet, then the neonates are put immediately onto the good diet when they're weaned.
Mm-hmm.
The parents aren't over vaccinated, the kids aren't over
Mm-hmm.
vaccinated, they're not living in an environment where they're exposed to secondhand smoke and flame retardants and glyphosate.
Mm-hmm.
Pick a problem. you know
Yeah, yeah. Basically, it's about reducing the different factors that can play a role and that contribute to cancer formation, and it definitely starts early. I sometimes get a little frustrated that because people are in love with their dogs, and breeders are in love with their dogs, and it's their pride and joy. And I find it a little challenging. And I agree with you that genetics don't play a huge role, but they may play 15, 20%,
right.
and the rest is epigenetic. I still find that we could, even if it's 15 to 20% elimination, but I think that sometimes we don't focus on the genetic traits, and we just kind of hope that it's not going to happen in the next generation. It does happen, but definitely the external factors and the epigenetics are important. I also know that in cancer, inflammation is important, and that's kind of a precursor to cancer. How do you deal with that, or what do you recommend people to do if when it comes to inflammation?
Well, so stress is a huge player in inflammation. And I think it's, first of all, our animals are so tuned into us. So if we are living a life of stress, they are
Mm-hmm.
taking on that stress. They take on so much
Mm-hmm.
from us.
Mm-hmm.
um, so, as a matter of fact, I was talking to an animal communicator at a few years back, and at the time, my 21-year-old cat had lung cancer, and my 17-year-old Cocker Spaniel had lung cancer. Nobody smoked in the house. They were old animals that developed lung cancer.
Mm-hmm.
And so the communicator said to me, our animals take things from us. You need to check everybody in your household. So, of course, I ran everybody off to the clinic, and we all x-rayed our chests and said, well, good, we're good. But the animals took that on for us. Thank you. But so I think we need to be concerned about emotional stress. We need to be concerned about exercise and keeping our animals moving, keeping the chi flowing. And giving them some entertainment, not just laying in the corner all day waiting for us to come home. There's just so many factors that play into it. So, in order to decrease inflammation, we need to have we need to decrease stress, and we need to increase movement and mental stimulation. But we also need to have a diet that is going to be anti-inflammatory versus pro-inflammatory. So getting rid of all those starches and sugars and processed foods and chemicals. So we want to, I'm just a huge fan of whole food diets that are balanced using whole foods and real products and not, synthetic chemicals. Um, And I love to include, because I'm the food person, I love to include foods that are antioxidants and that are cancer
mm,
fighting. So I'm a
mm,
huge fan
mm,
of medicinal mushrooms in my pet's diets. I'm a huge fan of things like blueberries that are great antioxidants, dark leafy
mm,
green veggies,
mm,
cruciferous veggies. I mean, there's so many things
mm,
that we can
mm,
do that we kind of ignore because it's just too easy to just open a package and dump it in the bowl.
mm, mm. Do you think that people should be giving, let's say, turmeric or some other ingredients that are known and researched as anti-inflammatory and potentially anti-cancer? And from what age, if you do recommend that?
See, that's really hard to
Yeah.
know when we should start those things. And I think part of it depends on the size of the dog and the breed of the dog.
Mm,
Like I
mm,
start giving my guys deer antler velvet and green lip muscle kind of right out of the gate to protect their
mm,
joints. Like I'm going to be
mm,
proactive.
mm,
I'm going to protect your joints.
mm,
Um,
mm,
my guys get omega-3 oil every
mm,
day,
mm,
even my
mm,
youngsters, because
mm,
I want to
mm,
make sure that we're getting that anti-inflammatory effect.
mm.
Um,
Absolutely.
vitamin D levels. I think that all of our dogs should be tested for vitamin D levels twice a year
Mm, mm,
because the puppies tend to do better if they're on a good diet, but as they age, they're not converting it as well. And we have so many animals who have low vitamin D, and that just opens them up to so many problems.
What is
So
the percentage of animals? What do you guess is the percentage of animals that have low vitamin D levels?
for the seniors, it's
Hmm.
probably three-quarters of them.
Oh wow, wow,
I think
yeah,
it's really high.
yeah, yeah. And it just cascades down the whole metabolism, right? From
Mhm.
mobility, bone
Yep.
density, neurological symptoms, like
Heart
anything.
disease,
It's just heart
cancer.
disease, yeah, cancer, yeah. So I know that people will. We talked a little bit about the anti-cancer foods and so on. Like, is there? I'm gonna go right down to. We're gonna first go about or dive into the conventional treatments, and then we'll kind of step into the holistic approaches. What do you think of radiation and chemotherapy for dogs? Would you take your dogs through either chemotherapy or radiation, and why, or when, or when not?
So this one is tough for me because, like I said, I had the 21-year-old cat and the 17-year-old dog, both with lung cancer.
Mm,
And I did not do chemo, radiation. Like, okay, you guys have had a good life and a good life
mm,
span. And they were, I only found out that they had cancer because I was x-raying them for something else. They were completely
mm,
asymptomatic, eating, running around,
mm,
playing. And I was just like, okay, why would I
mm,
do something crazy here?
mm,
So they were supported nutritionally and with herbs and that sort of thing. And their life was great until the day that it
mm,
wasn't. And on that day, we made a decision.
mm,
Um, I haven't had a lot of other cancer except for Myra. Myra was my little rescue Cavachon.
mm,
Rescued her at 6 years of age. She came with bladder stones, ear infections,
mm,
no
mm,
hair, alligator red skin,
mm.
just
A lot of inflammation.
yeah, she was just inflammation from one end to the other, had spent
Yeah.
her life getting courses of antibiotics and steroids and not enough of them to clear up anything and really horrible food.
Mm,
She also lived in a very stressful environment with she was originally bought at a pet store, so poor genetics to begin with, bought at a pet store by a single woman. The woman got married when Myra was maybe around 4. The husband brought in a husky puppy that was untrained and hated Myra, so Myra hid all the time. And
mm.
then when Myra would pee on the floor, because nobody knew she had bladder stones, everybody would go ballistic and scream and yell and beat the dog. Luckily,
Oh.
the woman decided to give up the dog. Thank goodness. So she
Mm,
came to me,
mm,
and the parting words that the woman said were, "Oh, by the way, she pees on the floor for spite." And I went, "Yeah, or maybe not." So, oh, look, we have bladder stones. Um, so I did everything I could to turn Myra around. And literally within 6 months, she had a full coat. Her skin was beautiful. Her
mm,
stones were gone. She was
mm,
happy, playful, wonderful dog. But a year later, intestinal lymphosarcoma. And
mm,
She didn't even get the mild one. She got the cat form, which was much more aggressive. And so we did surgery. She actually had 2 surgeries because the first one I thought was just an obstruction. So I went in and took out the piece of pineapple that was stuck in her bowel. And then 2 weeks later, when she reobstructed, we went back in and removed that section of bowel, luckily sent it out for biopsy and found the lymphosarcoma. Because it was so aggressive and because I was a little freaked out as what to do, because food therapy was going to be tricky. I've got a dog who's got a bowel problem, and even getting nutrition in was tricky. I knew it was very aggressive, and I knew that herbs, antioxidants, nutritional therapy was going to take some time to work. So I actually took her to an oncologist, and interestingly found a TCVM trained oncologist. So she would use herbs as well as chemo. And so we agreed to do chemo. And that's one of those things where people had asked me for years, would you do chemo? And I always was like, I don't think so. Like, and I was, and you make decisions based on fear a lot of times. And I was afraid of losing the dog. So we decided to do the chemo. And at the time that we decided to do the chemo, she had healed from her surgery, but she already had a new mass in her bowel. So that was part of the decision of going with chemo, because she was already making new masses. And after the first 4 weeks of chemo, we did an ultrasound and there were no masses. And we drank champagne and said, we cured the dog. This is the most amazing thing ever. The next week we went back and I said, she's not eating well again. Something's up. We did an ultrasound, 3 new tumors. So we went from none to 3. And then a week and a half after that, she developed a tumor in her trachea that blocked her airway. So then we did a tracheotomy so the dog could breathe, so that we could let things hopefully work. None of it worked. And she ended up dying. Well, I put her down because she was just in horrible shape. The drugs destroyed her, literally destroyed her. The cancer destroyed her as well. But the drugs, I thought, destroyed more of her body than the cancer did.
There are some exceptions in cancer, where obviously in non-Hodgkin's lymphoma, right? It can be treated, and is it Hodgkin's or non-Hodgkin's that can be treated easily? Anyway, one form of lymphoma. I'm not a human doctor, so I'm excused for the ignorance.
I don't do the human stuff.
Anyway, but I do find that with some rare exceptions, poisoning the body at a time when it's already stressed and when it's already struggling with maintaining the immune system function and all that. It seems like surgery and chemotherapy and all those treatments are like a balloon that you push in one hand and then it pops up somewhere else, and it pops up in 3 different ends, right? And I have never been big on chemotherapy or radiation treatment, because I always try to remind myself one thing: dogs don't have a perception of time. They only have a perception of quality of life. And if I imagine my dog being on IVs and being in hospitals and going through surgeries and serious procedures, I know that it is really hard, but it is so important to let go and be there for them. And surprisingly, when you don't do these things, these animals actually live sometimes even longer, or at least as long as if you do nothing. So it seems that we kind of are aligned there too. And thank you for sharing, by the way.
She was obstructed, and so I couldn't even use nutritional. Like, the dog couldn't eat. And the chemo shrunk the tumor, so I was like, oh, this is great. But we know that when we do chemo or radiation, we kill the easy to kill cells. The really resistant, nasty ones, they don't get killed. So when it comes back 10 times worse. And that's exactly
because you basically kill the ones that are prone to the chemotherapy, and you leave
the easy guys.
Yeah, exactly. So it actually doesn't really solve anything unless we are able to. Obviously, there are some huge advances in immunotherapy and genetic engineering and all that stuff. And I think that in 10, 20 years from now, we'll be in a different space. Maybe there will be treatments where we can really target the cancer cells so much better. And it's already coming, right? Like it's already available.
I'm a huge fan of the immunotherapy, and I'm really hoping that research goes more in that direction than search, destroy nuclear waste, because the nuclear waste was not pretty for Myra, and one thing I can say, which speaks to what you just said, that she would bounce out of surgery and literally bounce into my arms 2 hours later and be like, okay, good to go. And
Yeah.
she was
Mm.
happy that we made a bucket list and we took her to, do all the things that every morning we woke up and said, what does Myra want to do today? And so we would do what we figured out Myra wanted to do, whether
uh,
it was go to a pet store and
uh,
buy more toys, go to a walk in the park, go to the lake, go out for lunch, order a hamburger. So we, you know, we learned a lot in how to enjoy every day because that little dog was enjoying every day, and we were going to make sure, no matter what, that she was enjoying every day.
yeah, yeah.
So, the positive came out of it, and we did get 8 weeks with her, which, because she was obstructed with the masses in her bowel, might have been a couple of days. And the chemo she handled really well up until like the last week, and by that point she had been through 4 surgeries. She in 8 weeks she'd been through 4 surgeries. She'd been
Mm-hmm.
through horrible chemo.
Mm-hmm.
She handled it fine. I didn't. She handled it fine. And if we hadn't done any of that, our time with her would have been shorter. So maybe, as we say, the path that leads me, maybe I was led down that path to give me that 8 weeks to come to grips because it was such a shock when she was diagnosed.
Mm-hmm.
So, and it also gave me the opportunity to learn a lot and be able to use that to teach my clients.
Mm-hmm.
Um, so, and also to learn to live in the moment a little bit more instead of being that person who's worrying about, well, what happens next week with
Mm-hmm.
her? What happens next week? Instead saying, oh, what are we doing right now? And I think a lot of us can learn from that. And I had so many clients over the years, they would get a bad diagnosis and they would go from one oncologist to the next, to the next, to the next. And they would go
Mm-hmm.
from one veterinarian to the next, to the
Mm-hmm.
next, to the next, hoping that someone would give them a different answer or a promise of a cure. And, by the time they would come to me, I would look at these mountains of records and the number, like they were literally going to 3 and 4 veterinary visits a day, not even a week, a day. And they would come to me. And by that point, I would say, I have nothing to offer you other than stop doing what you're doing. Let your dog go
Mm-hmm.
enjoy
Mm-hmm.
life. I want you to leave here right now, go for a walk in the park along the river. Do not stand here in my office. I am not going to poke, prod, or do anything to your animal to do more damage. Your animal
Mm-hmm.
needs to have decreased stress, decreased inflammation. Your dog needs a walk in the park. And
Yeah,
so I
yeah.
think that's one of the things that we need to help clients get,
Mm-hmm.
that, okay, you got a bad diagnosis, it really sucks. Don't spend, like, I have an uncle who
Mm-hmm.
has chronic pain and chronic illness, and literally his
Mm-hmm.
entire life is doctor's offices. I'm like, that's a terrible way to live.
Yeah,
Doctor's
and
offices are
we have to become in a way therapists and emotional support and all that. And I think that the reason why people, and we all actually, have such difficult time to let our dogs go is that they are our most reliable life support, if you think about it, and especially at times when the humanity is going wild and crazy, and pets are playing more important role than ever in keeping us sane and mentally well. I also, as you're talking, I was thinking, everyone who is looking for a good vet should actually ask them about their own pets and their own experiences, because what you described was so beautiful, and it's undeniable that you care so much. And I know that you care not only about your pets but also about everyone else's pets, because I've seen you work, and I've seen you being passionate about things, and it really is beautiful and inspiring. I do want to ask you about, there's some substances that are being used now, and research has confirmed that they may either be really effective in cancer prevention or even cancer treatment. There is NMN, which is nicotinamide mononucleotide, which is a kind of like a DNA repair and enzymatic repair and mitochondrial boosting system. Then there is rapamycin, which um, used to be called immunosuppressive drug, but we know that it has been mislabeled, and it's more immunomodulant than suppression drug. And then there is also turkey tail, which is used now especially in spleen tumors and similar. Have you had any experience? Do you think that animals should be on these, let's say from middle age and on, or in the more advanced age as prevention? Because, it would make more sense on some level. But I just want to know what your opinion is, because I don't have a 100% answer. I have an opinion, but I don't have a definite answer.
I have an opinion on the mushrooms because it's food, and so we're not going to do any damage by feeding mushrooms. My dogs get mushrooms in their food. I take 2 different mushroom powders every day to try to keep my brain functioning. The other two, I have been reading about them, and it's kind of one of those things where I'm like, we're a little early on, and I think I want
Yeah,
to see more studies. Like,
yeah,
it's one of those things, like the studies that Purdue did years ago, where they took a litter of Labrador puppies and they separated them, and half of them just got their dry kibble, and the other half got their dry kibble with
mm,
30%
mm,
fresh
mm,
veggies on top.
mm, mm.
And then they looked at who lived longer, and shocking, the ones that got fresh food lived longer. So I think we need like studies, and they take a long time to do, where you take
Yeah, yes.
multiple litters of dogs and you separate them, and this half gets like the rapamycin, the other half
Mm,
doesn't.
mm,
And then we really look at statistics, and we really monitor to
mm.
see, is there a negative side effect? I mean, we don't know. We see that there are,
Yeah, yeah.
looks like some positive side effects, but what if there's negative that we don't know?
It's really interesting because with the M&M, obviously, the whole ATP and Krebs cycle pathway where the NMN kind of can plug itself in is common to all life. I don't know whether plants, but definitely all the animals. So, we actually have done last year. We don't have it evaluated. We have done kind of like a clinical trial with about 25 dogs, maybe more, actually 30, 35. I can't remember the number. And we don't have it evaluated, but the good news is that we have not seen any side effects.
Good.
I started taking an M&M as I usually make myself a guinea pig. And I've been really curious, reading all the research in different books and so on. And I noticed 2 things: that when I exercise, that my exercise tolerance is much higher or greater, and I have lost weight without even trying, back to my university weight, without even trying, without doing anything differently. So there was a big surprise. And so we're going to have the evaluation of the study this year. We had a little bit of a problem with the database, and we can't export the data until the programmers fix it. So we'll be doing that. But so I haven't seen any side effects. That was the nice thing, and there are
Great.
some hopeful lights of seeing. I'm an old dog too, so I can I make myself part of the trial. And with rapamycin, I think that rapamycin is especially useful, or maybe useful, if we do more research. And there's Caberlane study, which is one of the few studies with rapamycin in dogs, and it proved that there is an improvement in cardiac function. But I do think that if there is, let's say, a terminal cancer, or if there is terminal disease, or if we see that really we have a 12, 13, 14, 15-year-old dog or older, and there is not much we can do, those are the times where we can potentially boost the body and boost the system and improve the immune system function, T cell function, and kind of simulate what rapamycin does. It simulates fasting, which is very similar to ketogenic diet. So
Right.
that's, again, I'm like you. Like, I don't think that everything is answered, but we need to be a little gutsy and a little daring to kind of search for more, and
Oh,
how we
absolutely.
can do more. So I agree with you 100%. Now, ketogenic diet, I don't have much experience in dogs with ketogenic diet because I've been out of the practice for a few years now. We kind of are the same vintage, so we practice for over 30 years, and then we say, okay, now we have to pass on the information because we are totally demented, right?
Yeah.
I'm sorry, I'm just kidding. But anyway, ketogenic diet. because I know that many people ask about it and use it. Have you had any positive experience with the ketogenic diet?
I
And when,
have.
or are you, where are you at with that?
I've had good experiences with it. Not all of my cancer pet parents wanted to do it, but those that did, frankly, I would say it was about a 50-50.
Mm,
We had some that I didn't, and it just, again, a lot of times it depended on the cancer.
mm,
I had a 6-year-old German Shepherd who had osteosarcoma in her jaw. We found that it was maybe the size of an acorn. She was just there for her
mm,
routine
mm,
physical.
mm,
And I said,
mm.
"Oh, how long has this little bump been on her jaw?"
Yeah,
And the
yeah.
owners hadn't noticed it. That's how small it was. Good
Mm,
owners, dog is raw fed, minimal to
mm,
no vaccine, like
mm,
everything that you're supposed to do right.
mm,
And so I x-rayed the dog, and she already had a lung full of mets with this little itty bitty teeny tiny thing.
mm,
And so
mm,
I pulled out all the stops, and they did do the keto diet with her. And they actually did it with her brother as well, who was 13,
mm,
13-year-old Shepherd.
mm,
It was great for him. It was great for his arthritis. He had anal gland cancer. So he did a 180. He was great. It didn't do anything
mm,
to slow hers down. And well, maybe it did. I diagnosed her in maybe May, and we put her down the following January. So for
mm,
osteosarcoma that
mm,
was already in the lungs in May,
mm.
maybe it did buy us
Pretty
time.
amazing. Pretty
Yeah,
amazing. Pretty
I don't
amazing.
know. But we had other dogs where the keto diets really slowed things down, really made them feel better. So I think it is a tool that can be used. It's not for every owner.
Judy, how often have you seen uh, complete remission or cancer cure in dogs, like in practice? Or have you
Actually,
seen one?
yeah, oh yeah. I had I think one of my best cases, and it was one of my early cases. Didn't, I didn't know near as much then as I know now, but it was a standard poodle, and the people were great, raw fed dogs. It had been a breeding dog, and they adopted her when she was done being bred. So she was spayed late in life, like at,
Mm,
I don't know, 7. And she developed a really aggressive mammary cancer in the most caudal gland. And so, first it started out as sort of the cystic gland that's draining nasty stuff. And so we did some antibiotics, and it made it a little better, but it didn't make it go away. And I said, yeah, that's more than a cystic gland. So we removed the gland. I did the surgery. I'm not a board certified surgeon. So, yes, I removed the mass. Did I remove all the lymph nodes in the area? No. Did I remove the entire chain? No. Did I get clean margins? No. And I developed a diet and herbal protocol for that dog. She never had a mass come back, and she died at 16 and a half of totally unrelated.
oh my
So
goodness.
she was one of my early successes that I was just like, this is the coolest thing I've ever done in my life. And I used that protocol for quite a few mammary cancer animals over the years. Most of them did very well with it, and I can't even tell you what the protocol was. I don't remember. I probably have it somewhere. But most of them did
People will
very
be
well.
asking for sure. People will be
Yeah,
asking,
most of
what
them
is the
did very
protocol?
well. I had one dog that she went down the tubes like literally in a month. It just metastasized and was a train wreck.
Mm, mm,
But I had a lot of animals that we kept them in remission. Mast cell tumors I've done
mm,
really well with.
mm,
I had a cocker spaniel that came to me. The dog was, I don't know, 8 or 9, and had a huge
mm,
mast cell over the shoulder blades and a huge one on its butt, right where it had been vaccinated over the years. And so they'd been going to the university, vet school,
mm,
and getting chemo and radiation and you name it. And they just couldn't get these things to budge over, a course of months and months.
mm,
And finally, the university said, we don't have anything left to offer you. Take the dog home. The dog's going to die. The owner came to me, and I said, I don't know. So I designed a diet, designed an herbal protocol. The dog did great. The tumors never budged. They sat there as their little, big lumps that they were. They never budged, but they didn't do anything else either.
mm.
And the dog survived a house fire, and the dog died at 15, totally unrelated to the cancer.
Oh wow, wow. So it's quite amazing. I know that everyone has these incredible cases. The unfortunate sad part is that there are so many factors playing a role that
Oh, absolutely.
we can never at least for now it's we can do our best, and sometimes it works and sometimes it doesn't.
Exactly.
I have one question about what I've observed in practice, that some people, some clients, have a have many animals that are healthy and never get cancer, and then others um, have bad luck, or they come down, their animals come down with cancer. And you were saying that sometimes these animals take on the energy of the owners, but I'm worried about that because well, while we need to be aware of that possibly happening, I also don't want people to blame themselves for what is happening. So the first question um, is there any energetic connection between dogs and people and what you've observed? And second, how do you make sure that your clients and animal lovers do not blame themselves for what's happening in their dog's life? Because there are many factors, and so it's almost like two parts of the same question, I guess.
So it is human nature. We will always blame ourselves, no matter what happens. Doesn't matter. We will always ask why. Why did this happen? What did I do wrong? That's just human nature. We love to carry our little bags of guilt with us. It's what we do really well.
Mm,
Um,
mm,
and the answer is we like some of my. I had another holistic client, really holistic client, took such good care of her dogs, raw fed, no vaccines, blah blah blah. 5-year-old dog, amelanonic melanoma in the upper jaw.
mm, mm,
Didn't survive it. Um,
mm,
so what did she do wrong? Nothing. Did the dog have the genetics for it? I don't know.
mm,
I don't know the
mm,
history on the dog. It was a young dog.
mm,
It is so easy to blame ourselves for everything, but you can't control what happens. You can't control environmental pollution. You can control not smoking in your house around your dog. You can't control flame retardants that are on products in your house. Um, there's just so many unknown and uncontrollable factors, and we have to put ourselves at ease with that and just say, look, I did everything within my
mm,
power. Like me with
mm,
Myra, I did everything within my
mm,
power to save that
mm,
dog and to
mm,
give her the best quality of life. Did it end the way I wanted it to? No. But it was kind of one of those things every day when I woke up and did something on our bucket list. I said, when this dog does go, I'm going to have no guilt, and I'm going to have no reservations, and I'm going to know that I made
mm,
every day the best that I could make it. But it was a conscious effort to do that. And sometimes, like I had that 8 weeks to be able to do that. Sometimes we
mm,
lose them very suddenly. A ruptured hemangiosarcoma, they drop dead.
mm,
Something else that happens very suddenly,
mm,
and then we go, "Oh my gosh, I didn't even know that the dog had cancer. Was I neglectful? Why did my vet not pick that up? Why did I not pick that up?" You're always going to ask those questions, and there's no good answer. The one thing I can tell you though is it's not your fault. It is not your fault. We can't
as long
control.
as we do the best we can and the best we know, even
Right.
if we
So you may have done everything wrong, but maybe it's because you didn't know any better. And then
exactly.
once you learn, then could you? I mean, I've lost dogs to tragic accidents that I had to give up the guilt, and I
Mm,
was actually told that by an animal communicator. And this
mm,
is an interesting thing
mm,
that she told me. She said, when you have guilt over the loss of your pet, and I don't know what your beliefs are and other people's beliefs are on where our pets and we go after we leave this plane, but I know we go somewhere and we're reunited, and that gives me peace. But this communicator said to me, I had 2 dogs in my arms when I walked up to talk to her. We were at an event and I was already crying. And she said, "You don't want to talk to me about those 2 dogs, do you?" I said, "No." She said, "You want to talk to me about a dog you lost a year ago?" I said, "Yeah."
mm,
And
mm,
she said, "You lost her in a tragic accident." And I went, "Yeah." And she said, and you still
Mm,
have terrible guilt. Yeah. She said,
mm,
your dog wants you to know that you need to give up that guilt because you are holding her back from being able to enjoy her freedom. And she is happy and she wants to be even happier. So she
mm.
wants you to give up the guilt. And in that instant, I said, I'm giving up the guilt. And, I can still bring it up if I want to, but I had to give it up for her sake. And when that woman said that to me, it was a game changer for me. So it's like, I can't hold on to that. I don't want to be responsible for causing more damage than I already did. So, and I also am like, this was my little heart dog. And so I am 100% positive that when I cross the rainbow bridge, the first one waiting is going to be, there's going to be a lot of them, but she's going to be at the front of the pack. So
I love it. I love it.
that's how I deal with
I
it.
see the picture. I see the
Yeah,
picture.
yeah. So it's
Recently, go ahead.
very
Go ahead.
important to be able to give that up. Really is.
Recently, I just listened to a podcast. I can't remember what it was, but it talked about physics, and it talked about parallel universes and wormholes and string theory and so on, and the fact that physically and from the point of probability, there are parallel universes where you and I are walking and talking, and where our dogs are as well, and so on. And there's supposedly infinite number of these universes. So the idea that we are somewhere else, or that our pets are somewhere else, is actually real, and now coming to the forefront in physics. So it's not confirmed. We have to live in the mystery, and I have a feeling that we will never totally completely solve the mystery of the universe, because I don't think that we come for that to the world. But it's really great that we have our dogs and our animal friends, and that we can be there for them and do our best. I want to ask you one more question, because we are living in really difficult times, and we just emerged from one crisis, and now we're heading into another. What do you do to maintain your mental health? And is there anything that you recommend to our listeners and
Turn off the
dog
TV.
lovers?
Stop watching the news. It's all a bunch of lies anyway. Don't watch the news. I stopped watching the news 2 years ago. Best 2.5. Best thing I ever did. I used to be addicted to morning news shows,
Mm,
evening news shows. I
mm,
turned it off. Best thing I ever did. Second best thing I ever did is we moved to, well, I sold my practices so that I don't have that daily stress. I have different daily stresses. But we bought 23 acres and opened a farm animal sanctuary, and I adopted a bunch of animals from the kill pen, donkeys and hinnies and goats, and I have chickens and draft horses.
I'm coming. I'm coming
Yeah,
to visit.
the absolute best thing for me is that I get up every morning, have my cup of coffee while I read my daily positive
News,
devotion, whatever
positive
we want to
news,
call
or
it. But
podcast, or whatever it
yeah,
is. Yeah, yeah.
my
Got it.
daily
Got it.
positive moment with my
Yeah,
cup of coffee,
yeah.
and then I head out to the barn and I shovel poop. And
Oh, I love
shoveling poop is so
that.
good. First, I feed everybody, and donkeys are. I've wanted a donkey my entire life, and we adopted 3. They are the most amazing creatures on earth. First of all, their ears are just the coolest thing ever. But they literally scream for their breakfast. Like they're taking their last breath. They're dying if you don't get that bowl put on the ground immediately. So they see us coming down the driveway and they start screaming at us until we actually have their food bowls in front of them. And then I get to shovel poop outside in nature for a half an hour, listening to the birds sing. Everybody's munching in the barn. I'm moving hay around, so I'm being physical, getting my chi
Nice.
going. It is the most therapeutic thing. And I have a friend that I actually met through social media. She is a critical care pulmonologist in Chicago. So during COVID, you can
Mhm,
imagine what her life was
mhm,
like in that
mhm,
ICU for the past 2
mhm,
years.
mhm,
She
mhm.
flew to North Carolina to visit me. Actually, she brought a puppy for me. And she said, all I want to do while I'm here is shovel donkey poop and talk to donkeys and hug donkeys. And I said, you are more than welcome. And she said it was the best therapy that she'd had in 2 years.
Oh
And
my goodness.
when she arrived back at the hospital, her interns and residents had gotten this life-size cardboard cutout of a donkey and put it in their teaching room so that when she walked in, she had a donkey to hug. So
Oh, that's
donkeys,
amazing. Donkey therapy. So the most
donkey
important
therapy.
part is donkey therapy.
Yep.
Maybe you should trademark it. Donkey therapy. I obviously I've been around horses, or I grew up around horses, and I think the donkeys are like horses who do not put up with human BS. Basically, they're so smart and so
They
amazing,
are,
but they
and
don't.
they're amazing guard animals.
Uh,
But if they see anything in our woods or any like a fox goes across the property, man, they are all standing at attention, and they are a
yeah,
great warning signal. And they're great protectors. So a lot of people who have goat herds or cattle herds, they have a donkey to protect the animals because they'll kill a coyote. They get really upset if people come visit us at the farm and they have dogs that the donkeys don't know. The donkeys are standing at attention, ready to take them out. So they're really, but yet they're sweet as can be. My 1.5-year-old granddaughter can lead them around, pet them, sit on them. So they're very gentle creatures, but they're also good watchdogs.
special guard donkeys. So, Dr. Judy, where can people find you? I know that you have your own store and you have your website and you do a lot of work and you're tireless. You're like an energizer bunny. Where can people find you
It's funny, we
and
call
your
my mom the
products?
Energizer Bunny. My website is drjudymorgan.com, so very simple. And we have a new website called drjudyu.com. It stands for Dr. Judy University. That's our educational website. We have tons of
Nice.
courses: how to make homemade dog food, how to interpret lab values when your veterinarian gives you that piece of paper that means nothing to you. We are actually getting an equine course. Dr. Joyce Harmon is going to put an equine course on there for us. We've got courses from Nick in the UK on raw feeding and how to feed your dog raw bones, those sorts of things. So a lot of courses coming, and a lot of courses.
Mm,
There's actually one called Dog
nice.
Longevity.
Nice.
Uh, we're working on cat longevity right now. We're working on a hospice and palliative care course. So our goal is to be really educational support for pet owners,
Amazing.
because
Amazing.
you need to educate yourself and be your pet's best advocate. And that's the
So
best
it's
way.
Dr. Judy you.
drjudyu.com. And you can get to that through our other website, drjudymorgan.com. The drjudymorgan.com is our e-commerce site. We have over 350 products on there now, companies that we have vetted.
Amazing.
We're very much aligned with ethical resources, ethical sourcing, and ethical companies. So if we don't feel that the people behind the company are dealing ethically with other people, then we won't work with them. So, if there's something on our website, that we've done a lot of background research, and we have a lot of affiliate links on there, including one with Dr. Tobias.
And I know that you also wrote a book. Can you tell people where you find it, where you find it? You know where to find it. I know where to find it. I have it on my bookshelf. But where
Yeah.
do people find it?
So I've actually written 4 books. The most recent one is the Yin and Yang Nutrition for Dogs, Maximizing Health with Whole Foods, Not Drugs. That's also the most popular one. My first one, From Needles to Natural, is still very popular as well. Some things in there that I would change if I were to rewrite it at this point, which I will at some point. But they're available on Amazon. They're available in web stores, and they're also on our website.
Wonderful. It's been so much fun and such pleasure, even though it was a challenging topic. I always love to talk to you.
Thank you for the opportunity. I really appreciate it. All right. Bye-bye.